My name is Ankur Lodha and I'm one of the interventional cardiologists in Lafayette, Louisiana. I work with Cardiovascular Institute of South. How does the addition of E8 in your treatment arsenal impact your treatment of below-the-knee lesions and CLI patients? E8 is one of the IVL Shockwave balloons which has 8 emitters along an 80 millimeter balloon. It allows us 400 pulses at 2 Hz pulsing speed. It also comes in sizes that range from 2.5 millimeter to 4 millimeter and also sizes of 5 millimeter and 6 millimeters. I feel this is a much needed arsenal that I needed it in my toolbox for below the knee CLI patients. Peripheral arterial disease, in especially the region of America where I practice in, especially in those cases where we have CLI patients, we see extensive calcification in all the infrapopliteal vessels. Most of these patients have single vessel runoff, which is extremely diseased with calcium. Such a long length of calcification would need me to have a balloon which gives me much more pulses, and the E8 with 8 emitters along 80 millimeter balloon and 400 pulses is really what I need. Normally when we treat these patients, we are always looking for lengths which are around 240 millimeters. We are seeing that this calcium doesn't allow the balloons to give a good balloon angioplasty results. What the E8 will achieve in these particular cases is not only the modification of the intimal but also the medial calcification that is there. Thereafter, balloon angioplasty would be so good because the vessel will be much more compliant at this point. The 8 emitters will make sure that the calcium is being treated very homogeneously across the length of these infrapopliteal vessels. We have to understand that we do not have very good options when it comes to stenting in these infrapopliteal vessels. These patients have CLI, they have wounds, and what really is needed that these vessels to stay open. If the calcium is not really treated in the medial vessel, then those balloon angioplasty results are not going to be long lasting. Therefore, I feel that the E8 is going to really revolutionize the way the peripheral arterial disease is being treated in our below-the-knee CLI patients. The calcification that is seen in these patients would really be very well dealt with these particular balloons. So we are really looking forward to it.